We are wrapping up our week-long series, Resilience, 5 years after COVID. All this week, we've been looking back at that global pandemic and its impact still today, focusing today on something positive that came out of it all.
Yeah, virtual healthcare. We talked a little bit about this with our medical contributor, Dr. Becky Dawson, earlier in the week. This morning, Jacob Brooks is live in studio to talk about some of these healthcare providers, after talking to these healthcare providers about some of these adaptations they've made and how COVID is actually benefiting us here in 2025. Good morning, Jacob.
Good morning, guys. You know, at the start, going to the doctor online was pretty much a necessity when most places were closed. But now a lot of people are still taking advantage of all of these virtual healthcare options 5 years later. Highmark Health has something new, virtual physical therapy. Dr. Anil Singh at Highmark says it can be hard for patients to get to physical therapy. That can be because of the office's hours or people's physical limitations. That is why they developed this, a new at-home therapy program. So how it works is the patient gets this tablet that has computer vision, and unless the therapist guide them through the session. He says this is something that they were working on around the time the pandemic started, but it really took off because everything was moving online. He says in a way, it's a return to what healthcare used to be.
The doctors used to go to patients' houses. And somewhere along the way that switched and the doctors now made patients come to their offices. And I think these type of modalities and capabilities of virtual and digital offerings really take us back to having the doctor's office go back to the patient.
So this program obviously is not for all patients. Some still need in-person treatment. That, Singh says, is not stopping. But he thinks this program will continue because it's so popular with patients and physicians. Live in the studio, Jacob Brooks, Erie News Now.